Hello again, Craig here from forbiddenknowledge.info to impart some information to you that may not be on YouTube. I really don't know, I haven't checked, about removing dental amalgams and the consequences thereafter. I'm doing this video mainly to try to allow you to make a better decision than I made. Because I believed the scare tactics that was going all around from all the talking heads out there about dental mercury amalgams. And although it is a bad thing to have mercury in your body, certainly you weren't told this. At least I was not told this back when I did this about 15 years ago. This was kind of before really the internet was very prevalent and I didn't have much enough information to make my own decision intelligently enough. So let me explain to you, because I had my mercury amalgams removed. I had 7 of them removed about 15 years ago. The dentist I had do them, by the way. I'll tell you a little about this dentist. First of all, he was a holistic dentist. I had him on my show doing a show about mercury amalgams. So he knew of the issue. I had to travel a great distance to get to him. He actually did a Clifford's material test on me. I think that's what it was called. It's a blood test taken that shows your compatibility with various types of fillings that they can use these days, materials, because they have a choice of more than 100 different materials they can use these days, from ceramics to polymers to metals, etc. It finds what you're most compatible with. He also developed a shroud, a special device to help remove the fumes while the extraction is being done, so that the dentist and the patient are less likely to be consuming or getting excess mercury. So, in other words, this dentist should have known what he was doing. Okay, so it's not just some dentist around the corner. All right. So I had 7 fillings removed in 2 sessions, and half of them died. Okay, half of 7 doesn't work out right. Well, I don't know if it's been 3 or 4. I think it's probably 4. I don't know. I just had so many problems. I kind of lost count because it's over here now. It's over here now. It's like it just keeps jumping around. Now I got a problem over here. Got a problem back over here. So it's hard to tell which teeth now that I even how many went dead. What do I mean by dead? Teeth dies when you destroy the blood vessel. If the blood can no longer get to the tooth doesn't get its nutrients anymore. The tooth's going to die. It becomes brittle, and that's what happened. Tooth died. Well, and it kills the nerve ending. So you don't feel any pain, but yet the tooth is brittle now, can break real easily, and you can get root canals, problems in the root canals. The little tiny little canals down all the way into the roots, the dead material in there now can start rotting and start causing infections, which they call an abscess. An abscess is it's starting to rot down there. It's creating an infection, and you can start getting swelling and all sorts of things happen. In fact, I know somebody that actually had an abscess that grew so big it was like almost the size of it was bigger than a grapefruit on the side of his head, and he eventually died. So this is not anything to mess around with. Yeah, I had an abscess. I had an abscess for 2 years that I was trying to deal with the low-level laser. I was able to get the infection from getting out of hand, but it never corrected it completely, so I had to have a tooth extracted. So you have to have root canals done because of the dead tooth now, or else have it extracted. It's very controversial, that subject. And when you have a tooth extracted like that, or a dead tooth, now it causes an imbalance in your autonomic nervous system, your energetic system. This is not the program to try to explain that, but our medical allopathic community won't want to acknowledge that there's an energetic system in our bodies at all anyway, but do some research. Basically, it has to deal with your body's energies that you may or may not be able to believe or even sense, your chakras, your energy fields, whatever you want to call it. It disturbs that when you pull a tooth, and so now you got problems with that, and your autonomic nervous system is now not functioning up to par. I'm going to be posting an episode about dental proprioception very soon here. I've been lax in doing that because I had a tooth break yesterday. Reminded me I had to do this program, and so that's why I'm trying to get it done now. It's just back here somewhere, and I got to get this van emptied out every show to find it and be able to get it uploaded on YouTube. So the tooth dies. You have to have root canals. You have to have teeth extracted. You got broken teeth. You have to have crowns, then bridges and implants and posts and everything else. Thousands of dollars of dental work you may have to have because the tooth has died. It dies because of excess heat from the drill. In a nutshell, that's it. The question then arises in your mind, would I have it done again? If I knew what I do today, because back then I was researching DAMS. It's something I would definitely research. DMS, Dental Amalgam Research Syndrome, I think it's called. It's a magazine. Hopefully they're still around. I think they probably are. But there's a lot of scare out there, a lot of fear, and it's a bad thing to have mercury in our bodies, but if it's not causing you any problems, maybe you should leave it alone. Maybe not. That's your opinion. I'm not trying to sway your opinion. I'm just trying to show you what can happen, and maybe nobody else is talking about it. Half my teeth died from a dentist who knew what he was doing. Would I have it done again? Probably. With the caveat, I would probably talk to the dentist and say, hey, dude, you know, you could kill my tooth by drilling these out too quickly. Let's take our time, drill for a minute or so, go have lunch, go work on another patient, whatever, leave me sitting in the chair, whatever. I want to get this done right. I don't want to lose my teeth. That's probably the approach I would take it if he was willing to do that. Sit in the chair for half a day or whatever, do one tooth at a time, something like that, if I knew what I did today. Too late for that, obviously. Now I have problems, might even shorten my life. When you learn about dental proprioception, and this program I'm going to post, by the way, this dentist who developed this low-level laser that I used on mine, but I didn't get rid of it completely. During his lecture, he says, how many of you have had your dental mercury amalgams removed? About maybe 1/3 of the hands usually go up at most of these lectures. Okay, now leave your hands up if you had problems ever since. And virtually every program I've done on his, the hands stay up. Almost all the hands stay up. So in other words, I'm not the only one. I don't know if anybody else is talking about it, but this is something my dentist didn't tell me, and this is something probably all the fear mongers out there aren't telling you. And so that's why you need this information to make an intelligent decision about what you want to do. Because you may or may not want to have them done after you watch this video. I'm not trying to scare you, I'm trying to give you the facts. This is my personal opinion based on what has actually happened to me personally. All right? So thanks all for watching, and catch another dangerous YouTube video on Forbid TV. My name is Craig. So long.